When it comes to 50% ratings for migraines, the usual are those who really focus on the economic inadaptability, which is all good. There's nothing wrong with that. And it's something that you're going to want to communicate and prove to the VA for your migraine claim if you fall into that category. But what most veterans seem to forget is that medical evidence, hard, can't mess up, right in your face medical evidence is what's going to not only make sure you get the proper rating, but get service connected in the first place. And so if your medical evidence is lackluster, but you have your lay statements ready, your personal statements ready, your sick leave, all that jazz, and you really focus on the economic inadaptability part, you're missing a lot here. And I would argue that you're missing the forest through the trees. You got to look at the whole picture holistically: service connection, the clinical diagnosis, treatment that comes with the clinical diagnosis, and then, of course, in migraine case, that economic inadaptability. So hard medical evidence will win every single time. So before you submit your migraine claim, whether that is direct, secondary, exposure, MUCMI, go speak to your doctor. Whether that's private or through the VA, does not matter. But if it's through the VA, your medication, your treatment is going to be covered. So for instance, I use a device called gammaCore. I do 2 treatments of this in the morning, 2 treatments in the evening. It's very, very small. It comes with gel. You just put gel on the tips here, and then you put it on your vagus nerve. Boom, it comes with instructions. That's it. It's two minutes each. I love this thing. Highly recommend. And for me, it's free through the VA. So if you're 50%, if you're rated at 50% or higher, all of your treatment at the VA is going to be covered. If you're 40% or below, let's say you're service connected for migraines, then a gammaCore and other medication and treatments are going to be covered if you're service connected at 40 and below. And so the cool part is I'm traveling this week for Thanksgiving, and that's going to fit right in my bag, right? I don't have to worry about pills. I don't have to worry about any of that. All you need to do is talk to your primary care about your migraines. They will probably refer you to a neurologist, and from there, you're going to build a treatment plan for you, right? So for me, I use gammaCore twice in the morning, twice in the evening, 2-minute treatment each time. I'm also on a daily preventative that I take each night. Then I have some of the break glass just in case for any onset migraines. And the best part about that is with that medical evidence, right? Clinical diagnosis, you have all this treatment. The treatment is really telling a story about your symptoms, what you go through on a daily, weekly basis. Then you couple the medical evidence, then with your lay statements, your economic inadaptability this, economic inadaptability that. You even have a lay statement from your supervisor. You have a sick leave. You have a migraine log. You have all of that stuff. It is much stronger. It's a very full picture. And so I urge you, healthcare is important. Veterans need to seek healthcare, and you need to get treatment. You need to get treated for everything, not just things that are, or you're planning to get service connected. Anyway, that's all I got. gammaCore is that product, and you'll find all that below in the description.